Welcome, everyone, to Living a Bella Vita podcast. This is Erin Schmidt, editor-in-chief of Bella Vita magazine, and it's my pleasure to bring education and entertainment to you so you can live an inspired life and go after your dreams. Today, I'm so excited to have Dr. Joy Kong with me. Dr. Joy Kong is an expert in stem cell therapies. She is a medical doctor. She's also an author, a speaker, educator, and all around just an amazing woman. So thank you for being here today, Dr. Joy.
Thank you so much, Erin. I think this is going to be really fun.
Yeah, I'm excited. So I had the pleasure of interviewing you on the fly when I was at your center in Chatsworth, and I was so impressed. I was really loving all of the information you gave about stem cell therapies and answered a lot of questions that I personally had about it. So first off, I want to ask, how did you first get into the medical field? And what really sparked your interest in stem cell therapy?
I think I have a fascination for life, just wondering what's going on in this body. How are we walking, talking, these entities, right? Us and animals. So I was just fascinated by life, period, plants, animals. And I also really want to reduce suffering, starting with my mom. I was trying to help my mom to feel better. She had a lot of back pain. So I was, massaging her. So when I was giving her a massage, I just felt this, like I have this energy inside of me that I feel I can heal her. So that kind of started with me thinking there's a healer inside. So I was fascinated by neuroscience when I came to America, because I came when I was 20 years old. I could choose any field, but I was just intrigued by science. So I decided to, I thought I was going to become a professor. But when I actually did the research, which was good, neuroscience research, but I had a chance to shadow a OBGYN. And that's when I realized that I could interact with people. And that seems to be really fun. And it's so dynamic. You get psychology, sociology, you get, technology involved, all these machines and devices. So that's when everything just kind of came together. My brain says, okay, I'm happy. Everything is going on all at once. I can incorporate everything, synthesize everything, and then I can make a difference in someone's life. So that's how.
That's amazing. I know. And so you started out as a psychiatrist, a medical psychiatrist, and then switched to being a doctor more independently so that you could really, deliver some new and cutting edge treatments that you really weren't able to necessarily as just a psychiatrist. So tell us how you first got really fascinated with stem cell therapy. And first of all, please answer the question. There's a lot of misinformation on the internet, unfortunately, about stem cells, and people immediately go, oh my God, that's from abortions. No, it's not. And so can you please address that and then how you got interested in it?
Yeah, so in medical school, we were only told that there are stem cells, pretty much. That's probably all we were told. There are stem cells, and they can form all kinds of cells in your body because we studied just a teeny bit of embryology, showing how the babies, from a little single fertilized egg, how that became, 4 cells and then 8 cells and then, ball, and then how that convolutes and starts to form. So all those are stem cells. But that's all we know. We knew, okay, there's research going on. Even as a resident and later on practicing psychiatrist, talking with my friends, with doctor friends who were going into other specialties, no one knew anything about stem cells. So it's only later in my career, I think I have been a psychiatrist for 2004. That's when I started my residency program. Yeah, probably 10 years into doing psychiatry. That's when I ran into a doctor who was an anti-aging doctor. And to me, that was a whole new thing. What do you mean anti-aging? How do you know what kind of specialty is that? So he told me, oh, I have been doing stem cell treatments. And this is a kid I treated who had autism. And I gave him umbilical cord stem cells. And look at all these things that the teacher reported that were changes in him. So those included better eye contact, better ability to express himself, playing with kids better, not procrastinating, like all these things, 40 different things. He showed me the text from the teacher. So actually, as a psychiatrist, that really hit home because autism was the reason I did not want to go into child psychiatry, even though I thought I wanted to be a child psychiatrist because I wanted to catch people early before they start suffering from mental conditions. But what you deal with as a child psychiatrist mostly is autism, some ADHD. But I think it's pretty miserable, frankly. Yes, if you have a lot of patients and about not making much progress, that's a great field for you. Because literally, the tools we had as psychiatrists were tranquilizers or stimulants. We're trying to tweak the chemistry of the brain. Either we shut the kid up or we give them stimulants so they can actually focus. And so they're not all over the place. So those are the main tools. So the antipsychotics and benzodiazepines, those are things to kind of quiet them down and sedate them. And there may be some, antidepressants that may help them with mood disorders, but really there's no fundamental change. There's a little bit of progress if they go to have behavioral therapy, but basically we couldn't do a whole lot. And to see this doctor who knows nothing, probably knew very little about autism, and he just gave this kid an IV infusion of some cells. And then he's able to bring about the changes that I had no way of, of bringing about. So that was very, it was a paradigm shift moment for me. Is that what are these cells doing that we haven't been able to tap into? So that's how it got started.
Right. That's fascinating. And some people know that I have a daughter with autism. And so this is another reason that I'm so fascinated in this, because she is on a laundry list of drugs that I hate giving her, but, it's necessary if people until we find something better, right? And so my heart goes out to people that are in the audience that have that situation, which is why I wanted to do this podcast, because it doesn't just help autism. Obviously, it can help with a variety of ailments or disorders. It doesn't, I know you can't say it cures things, but it can revolutionize their health, et cetera, their functioning, et cetera. But I do want to clarify, you're using donated blood and cells from live births, not abortions. And these are coming from a facility in the United States that's FDA registered. So these aren't like random cells that you're just like, oh, yay, let's go down to, somewhere unethical and get whatever cells, and we don't know where they came from.
The process is highly regulated. So it comes from tissue banks that are registered and inspected with the FDA, by the FDA. And the tissue banks follow the guidelines of American Association of Tissue Banks, which governs all the tissue transplant donations. So this is no different than liver transplant, the process it goes through. So we have to obtain, the whole medical history consent, from mothers. And we only accept US mothers, and only when they're about to give birth to a live, healthy baby. So the baby is about to be born. That's when you ask the mother, do you want to save the cord for your own baby, or do you want to donate to somebody who may need it? So 90% of mothers, they don't have the money to save it because it costs a few $1,000s a year to just keep it cryopreserved. So they say, okay, I'll donate it. And then they have to go through very strict screening criteria, of their own history, everything, toxic exposure, sexual history, work history, and their family history and partner's history. So everything is accounted for to make sure the quality of the cord is not affected. And then it goes through all these screening, just like when you are donating an organ, you have to go through all the screening. It's the same screening, even though the product we use actually goes through a higher level of scrutiny than what's required by the American Association of Tissue Banks.
Thank you for
And all these are
clarifying
young,
that.
healthy mothers. Yeah, all these are young, healthy
Yes.
mothers who choose to do C-section. So we don't take vaginal births because
Okay.
you've given birth. So if you did natural
Mhm.
birth, anyone have seen it, it's not really a sterile process. It's a little messy, right? I've caught babies before, so I know what, everything is all coming together. So you can't assure the sterility of the tissue. But if you do C-section, everything's a surgical field. So everything is sterile. So that's where we actually obtain the donated tissue. So
That's
baby's born,
fascinating.
baby's healthy, baby's crying, happy, crying happy. And
Yeah.
then the cord is cut and the cord and placenta, sometimes they drain the blood first. So, and then that's put, on ice, usually overnight shipped to a tissue bank. But we actually, not all tissue banks are the same. So the products we use actually can be processed the first day. We prefer it to be processed the first day. So the morning, C-section, by noon, we're processing, the tissue cells should be out of the tissue. Yeah.
Wow. Wow. Thank you for clarifying that. I think that's really important, everything you just said, because there's so much misinformation and so much sensationalism about, oh no, it's this. So it's good to get it from a medical doctor who is doing this all the time, who gets it. Thank you for walking us through that. So tell us, I know we're not here to say this is like a miracle, like it's going to just save everyone's life, but you have seen patients who have had restored function, who have had a much decreased, in their ailments of whatever disease that they are currently suffering from. So tell us some of the uses for stem cell therapy and some of the maybe, changes that you've seen.
Mm-hmm. Yeah. So the cells keep surprising me. And of course, more and more research are coming out. So first, when someone has a condition, when they ask me about whether or not stem cell therapy can help, the first place I go to is literature. Has there been any research published that has shown benefits? And there are a ton. So just that is a ton, right? We're not talking about clinical experience. We're talking about published articles. So that's the only place that I'll cite. I'm not saying anything that we're going to cure, heal, but, just look at the research study. People have studied many autoimmune diseases. Autoimmune is a huge part because these cells, especially mesenchymal stem cells, that's big in the population of the cells that I'm using, is a big portion of it. Very powerful. They can help shift your immune system to a more balanced state. Of course, a lot of the chronic illnesses is because the immune system is not balanced. It's same as aging process because your immune system is getting more and more inflammatory. So you can't repair as well. So inflammation is so tightly wound with aging that they coined the phrase inflammaging. So because they're just hand in hand. So if you look at published articles, and that's where I teach the course, American Academy of Integrated Cell Therapy is the academy I founded. If anyone is interested in finding some real case studies, just go on aaict.org. There are case studies. So that actually lists all the cases most of them are patients I've seen, but there are also some articles, but this academy is where I train a lot of physicians. So I actually give the physician who takes the course lots and lots of articles categorized by organ systems and disease categories. So there are like 30 different categories. Eye is one category, right? The digestion is one category. Sometimes we do special organs, liver, heart, lungs. So everything is its own category. Within its own category, there are many, many diseases. And within each diseases, then there are different research studies that are popping out. Some of the more common diseases, when you have a more obscure disease, then there's not enough funding for people to want to study it. But as far as conditions, I've seen incredible for autoimmune disease, incredible for musculoskeletal repair. So that includes all your joints, soft tissue, right, tendons, muscles and ligaments, and then your different organs, heart, lungs, liver, your pancreas, even for diabetes, and for rejuvenation of the reproductive system, so ovaries and uterus, and for men, penis health. Or I've actually seen, I don't think there's a lot of research on testicles, but I've seen clinically how it was reversing testicular, basically inflammation and repeated infection. It's pretty fascinating. But, and then there are brain conditions. So there's a lot of research on, a plethora of brain conditions like dementia, traumatic brain injury, ALS, MS, Parkinson's. So all these, there are a lot of research going on. So, a lot of things.
Wow. Yeah, that's miraculous. I mean, really, even if you're able to get, let's say 25% more functioning or whatever the percentage might be, it's huge, because if that improves the quality of your life, if you are able to go off of some, medication that you've been dependent on, or maybe, literally dependent on. Some people are like, they're on pain meds that they cannot get off because they're in so much pain every day. I think it's just an amazing topic, and I'm excited as more research starts to come out on it. The really fascinating thing too is that you don't only do stem cell therapy on internal through IV or injections, but you also have a company that you use for external. So you have Chara Omni creams that people can apply to their skin, and I've been using it and under my eyes and up here, and I haven't had Botox for a year, so I think I'm doing pretty good at 50, almost 51. So I can attest to it does work. So tell us about Chara Omni.
Yeah, so this is a cream I developed really because of a search for a non-toxic, clean form of facial rejuvenation. And I don't know why it's so hard. People are so reliant on chemicals these days. So I'm just going to take out the bottle. These days, so this is, that's the cream. So even very expensive brand, when they say, oh, this is all natural, I realized when I flipped over at their ingredients, I was like, oh, okay, this definitely, all these are not natural. These are all synthetic ingredients. So there are a lot of unforeseen possibilities of hormone disruption and toxin buildup, because our skin is the most absorbent organ. We can absorb a lot. So I just wanted to create something that I know I can feel good about putting on my face. And then I realized that I know about stem cells, and I know the powerful regenerative potentials of stem cells. I can inject stem cells into the skin. I've seen it doing amazing things. Lesions go away, different conditions reverses. I mean, it's just like, if I can harness a portion of what I inject into this cream, that would be tremendous. And then I also know about peptides. It's a very hot topic, and these are signaling molecules that your body produces, and they are all very targeted. They have very specific functions. So some are great for skin rejuvenation. So if I can tap into those, so I put a multitude of peptides, and then the umbilical cord derived stem cells, along with the exosomes. That's, kind of part of the, kind of like the juice of life, the cells, and the fluid that's bathing the cells. So all that's in there, along with all these herbal extracts and antioxidants and prebiotics. So it's just a really incredible, healthy form of skin rejuvenation that I've been using it for 3 years, ever since I developed it. I remember when I travel, when I forget, I kind of freak out. I don't care what my friends say, how great their product is. I know it cannot be as good as this. So yeah. So that's Chara Omni. The cells are not alive. I don't want to misrepresent, but all these molecules and signaling, these components are still there, and they can produce these rejuvenation. That's why, some people with, for example, I know some people with rosacea, with chemical sensitivity, when they put this on, and what used to aggravate their skin no longer is a problem. So fine wrinkles release, because there are peptides that help with collagen production. So there are different things, and some are anti-inflammatory. So with combination of all these different things, including the herbs, some of the herbs actually have sun protection properties. Some are able to cleanse the pores, right? So you get the pores to be smaller and more clean. So there's all these ingredients, this synergy, kind of like a symphony that's in this product.
I love it. Yeah. And it's moisturizing too. I've been using it under my eyes and up here and down here where I need a little help.
I call it,
and I love it.
Fun. So there's no reason for people to do, I remember, these, even in China, because I came from China when I was 20 years old, that they started this whole series of products. You have to, to do the, what is it? The
toner spray.
Yeah, you have the toner.
Like 7 steps, and it's like, why?
Yeah, it makes no sense, because this one replaces all of them. That's the only thing I put on my face, because there are ingredients that help it to penetrate deeply. So you don't need to toner to, drive it in deep. No, you don't need that, because it already goes in deep into your skin. And you don't need, a separate serum, because the serum is part of the cream. We got stem cell serum that's in there. So it's going to be driven into your skin. You don't need a different night cream, day cream. During the day, yes, there's some protection properties, but your skin needs the same nourishment. So during the day, the sun protection can happen. At night, it just keeps nourishing you. And then you don't need separate eye cream, because a lot of companies, when they do eye cream, they really are taking out some of the irritating ingredients that's in the face cream. So then they give you a teeny little bit, sell it for $100, right? And you put a little bit around your eye. There's no reason to do that. If you have a very gentle, super powerful cream, then use that as eye cream. So that it's all in one.
Yeah. Right. Well, I love it. I think it's great. And you mentioned that you came from China, and there's a tiger in the background and Buddha.
Oh, yes.
And yes, you wrote a book called Tiger of Beijing, I believe. Is that right?
Yeah. Tiger.
There it is.
Yes.
It sounds so fascinating. Tell us about that.
I love the tiger. I just think they're so incredibly beautiful and mysterious and just powerful, right? This fearless power. So I always feel that, that like this, I love them. I love them so much. And when I was thinking about what I went through when I decided to come to this country, you really have to capture some of that fearless energy and this power inside of you, that no matter what, because this book started with my visa rejection. So a little joy, age 20, standing in front of the American embassy, just getting flatly rejected. This is, when I was still young and arrogant, right? Oh, I want to come to America, of course, and I'm smart and I have good grades. Of course, they're going to accept me. I'm one of the luckiest people, so they're going to give me the visa, and my parents are coming with me. We're going to buy me a suitcase. Everything's going to be great. I worked very hard for a year and a half. It was a very, very tough because all my friends were telling me, "Why are you even trying? Because it's next to impossible." It was very difficult. The embassy rejects about 90% of the applicants. And I had no money, no connections, right? So I didn't really have what it kind of took to get the kind of people I need to sponsor me. I didn't really have that. So we were scrambling. We scrambled for my mom's students because my parents are teachers. So this student was willing to be my sponsor, be the affidavit of support. And that did not fly well for the embassy. They're like, nah, we don't believe he's going to help you. Mm-hmm. So then you get into a place where with all your young, whatever rambunctiousness inside, this energy that's inside of you, and then you're slapped in the face saying, told you no, yeah, we don't care if this is your dream, too bad. So that's when I had to tap into just what, if this is what I really want in my life, that I felt something deep inside, that's where I belong. What do I do? So this book talked about what I did. Well, it's a little, unusual what I did. And is really from, partially coming from anger. That's the ferociousness of the tiger, right? Like, roar. Who are you? I'm going to bat at you. I'm going to do whatever I need. I'm going to claw. I do what I can. So that's what I did. And then, the universe started to work its magic because I get my first, batting, at the world. And then things start to happen, right? You're setting up the momentum for the universe to work its way, to allow things to happen. So one thing led to another. And that actually landed me on the US soil about, 8 months after my visa rejection. But the story doesn't stop there. Just because I landed on American soil doesn't mean that it's all hunky-dory, that this is, she's going to live a good life. I actually ran into a pretty bad situation because of the way the universe is working. So then I had to overcome that as a young woman. How do you survive a situation where your freedom, your identity, were about to be kind of crushed, in very oppressive environment. So then it's about saying, no, I have a whole life ahead of me. I'm going to fight back. I'm going to do whatever I can to live a great life. So then I had to basically get out of a cage. So that talks about that process. So it's only about 3 years of my life, but it's a very dramatic 3 years. That's why I was going to write this book as a novel. I wasn't going to write it as a memoir. I thought this is going to be a great novel, but then I just got sick of, talking about she, I gave her a name, June, and I got so sick of it. It's like, you know what? I'm just going to own it. This is me. So what? The whole world knows this happened to Joy. Big deal. So that's why I just wrote it as a memoir.
I love it. Wow. Well, I'm going to pick up a copy of that. It sounds so fascinating. And finally, I always ask my guests, what is your definition of living a beautiful life? What are some things that you do, or just in general, how do you experience that?
Living a beautiful life. Yeah. If you can just, I guess, really feel how extraordinary existing is. Because the alternative, we know the alternative of not existing, right? So what's great about existing? I do believe that there's an eternal spirit, soul, whatever you call it, this consciousness that's going to live on, but it's going to be on a different dimension. So in this dimension, it's so rich. is so fascinating. All the trees, all the birds, all the creeks and the ocean. Um, so everything, each other, you can touch and hold each other. So all these are miracles, all these amazing animals, right? The tiger, these are miracles all around you, walking around, showing you just, how glorious it is. If you can actually just tap into how beautiful it is, and then be a part of this beauty, right? Don't be a destructive force. Don't make it miserable for anybody, for any form of life on earth. Just, be part of the beauty. Yes, we have to eat, sometimes we have to, animal kingdom is not so, just all, cherries and, roses and, yeah, we have to eat. But in between, we do have to sustain life itself, but we don't have to be mean, don't have to be nasty. And we can, animals, a lot of animals, not all of them, kill humanely, I think, but most of them, quick, that, I mean, I'm going on a philosophical tangent, but I do think if you can appreciate just, the beauty of life and then be a part of making it more beautiful as we can. And that's why I'm a doctor. I want people to suffer less, right? So you can experience joy more. That's the whole point, right? We're elevating joy. We're just
Right.
spreading joy. Yeah. That's why I named my clinic, my company, Chara. Chara is the Greek word for joy. It's about this deep-seated sense of peace and gratitude and connection. That kind of joy. It's not just, oh, I'm happy. Oh, I got I got whatever, a bonus. It's not about little happiness. It's about this deep sense of appreciation and gratitude and happiness. Yeah.
Love that. Well, you were aptly named Dr. Joy. I love
I
that.
thank my
So
mom.
it's been such a pleasure getting to know you even more. And we're going to be following up with another conversation about your ketamine therapy. I know that's another hot topic. And I think that it's fascinating and it could really help, and mental health is so important. So we'll be following up with that in another video. Be sure to go and follow Dr. Joy. You can find her on social media. You can find Chara Health, Chara Omni. We'll be putting the links. Make sure you go and like and subscribe and comment if you have any questions for Dr. Joy, and we'll make sure she sees them. And again, you can contact her. She's in California. You might be able to go and see her speak. You can go and get her book. And so thank you for being here. And thank you, Dr. Joy, again. It's been a pleasure.
Oh, thank you so much, Erin. Yeah, I really enjoyed just sharing some thoughts and stories.
Yes, thank you. I really enjoyed it. Bye-bye.